Hi, this is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County. It is January 29th, 2021, believe it or not, and another of our Facebook Live events. We've already gotten some great questions on our Facebook questions at douglaspublichealthnetwork.org website, and so we're going to go through those first, but we'll also have plenty of time to answer your questions, so if you put them in on the chat section, Vanessa, who's working with me tonight, is going to go ahead and put them in for me, so thanks on that. If we don't get to all the questions tonight, I'll try and answer them later tonight when I get home. So as we always do, we start at the top and then move down. So from a world level, still a very active pandemic. We've hit 100 million cases and 2.1 million deaths. And that just is a stunning pandemic. It is, of all the diseases we've had, one of the biggest pandemics. Now, AIDS had a similar kind of toll, but that was spread out over many years. And the 1918 flu epidemic actually had many more deaths, especially considering the population was smaller, and that was over time. But that was truly a devastating pandemic. This one also has been a devastating pandemic. In the world, still very active in the U.S., in Spain, in Portugal, in Czech Republic, and Israel. So kind of funny, scattered places in Europe. So when you look at the heat map in Europe, there are some countries that are really hot, surrounded by countries that are not. And so even though there's free movement in Europe, these really do seem to be fairly localized. Overall in the world, cases are beginning to decline, but deaths are still high. You'll remember though that cases are followed by hospitalizations and are followed by deaths. And so that the death peak usually follows the case peak by several weeks or so. In the U.S., we're at 25.8 million cases and 433,000 deaths. December and January have been terrible months for deaths. In December and January, COVID was far and away the leading cause of death in the U.S. More than heart disease, more than cancer, more than accidents, more than strokes. And so really, truly a terrible pandemic. When we got to the end of the year, they calculated life expectancy, and life expectancy overall went down last year because of the COVID deaths. But the good news is that cases in the U.S. are beginning to slow. The heat map, which a few weeks ago looked pretty much dark red all the way through, is now beginning to have areas that look better. But what I'm seeing is, interestingly, that there are areas that are really quieting down, but then really real hot spots. And the worry about the hotspots is those hotspots represent areas where there may be this variant virus. So, for example, when you look, South Carolina is inexplicably hot. Areas around them are not hot. South Carolina is not unusual in other ways, but they noted that they had 2 of the South African variants in South Carolina, and that could explain why the disease is spreading so much more there than it is in surrounding areas. Still very active in North New York, South Carolina, Texas, parts of Arizona, and parts of California. In Oregon, 140,000 cases. We have the lowest case rate in the U.S. So you look at statewide, the number of new cases per 1,000 people per day, and we're in the teens. The U.S. overall is in the 40s to 60s, and so we're relatively low. When I looked today, we were the lowest attack rate over the last 7 days in the country. Douglas County, we're at 1,841 cases and 48 deaths. We are the lowest big county in the lowest state. There are now a couple of counties that are below us in the country, but we're still relatively low. What we've seen in this last week are 14 school outbreaks. And so the school outbreaks have tremendously increased the number of contacts we have. We don't think there's been a lot of spread in schools, but it's really disruptive when a school has a case in a school because that whole class now gets quarantined for 10 to 14 days. What we also seen is travel is the big deal, and we have some international travel now that is bringing cases in Douglas County. So again, we've heard this now for 10 months, that this is about people who are not good about social distancing, people who are not good about using masks, big gatherings, and travel. And so it hasn't changed. 2 big things this week are going to be about the variants, and I'm sure we'll get some questions about that, and about the vaccine. And if we don't get a bunch of questions about that, I'll be a monkey's uncle. which is a really old phrase. Okay, so Karen says she thinks that there were 30,000 people in the 1A population, but the OHA vaccine map shows we've only given 4,000, and yet you think we're pretty much done with 1A. How could that be? So I think she was confused. So there are 30,000 over the age of 65 who are going to be in the over the age of 65 group. We think there are about 12,000 in 1A. So the 4,000 number in Douglas County does include the vaccines that were given by the VA, which we think there are several hundred of those. And it doesn't include all of the vaccines that were given in the Federal Pharmacy Partnership. So we think we're at about 6,000 vaccines given in the county, which would put us at about 50%. And when we do surveys around and we say what percent of the people to go ahead and expand through the 1A group, then through the teacher group, and then get to seniors. This maldistribution of vaccines in Oregon is now well recognized and is going to get straightened out over time. So when you look at Douglas County numbers, we have one of the lower vaccination rates in the state, but we've gotten about a third of the number of vaccines per capita as some other counties. And again, lots of complicated stuff. I'm not going to lay any blame, but it's sort of the explanation for what goes on. We've been told that we'll get caught up in the next few weeks, which is great. So someone says they're 73 years old, they have a heart condition. When are they going to be available for vaccine? And the problem is that you have to judge who's eligible when. And so the state has decided to go by strict age. So we're going to do 80, over 80, then over 75, then over 70. So when we get to the over 70, which should be towards the end of February, you should be eligible. The problem has been, and it has been so hard to parse out people's underlying conditions, because there's some people who are very sick, but they may not have conditions that really affect their survival. So one of the things that's striking with this is that high blood pressure, which is not that serious a disease, it doesn't cause a lot of symptoms, does put you at risk, seems to be actually one of the highest risk factors, whereas bad asthma does not. So it's really confusing, and it would be hard to judge with your heart condition whether that's a heart condition which is a very worrisome heart condition or not. So Oregon, because you have to get these done, has decided to go at age level. So you will be eligible for vaccine when the group from 70 and above are eligible. It is not a great way to do it, but nowhere in the country has figured out a great way. The Brits have done the same age thing that we're doing in Oregon. Some other areas have done larger age bands. Some have just had a free-for-all. Whoever shows up first gets it. However, whoever shows up first is really problematic, because probably 90-year-olds can't sort of drive and wait in line for 12 hours to get it done. And we think they're at perhaps the highest risk. So somebody wants to know about the drug called Apolidin. So Apolidin is a drug that's extracted from sea squirts, these little sea cucumber things. And it's been used in Australia to treat multiple myeloma. And so they did some lab things, and they showed that this did seem to inhibit the virus a lot. And they're now just starting into the phase 3 trials, where they're going to try it in people and do placebo-controlled trials. Really interesting. There's no idea why this should work or why it should be effective. So this is one of the dozens of promising therapies that need more study. So of the promising therapies, only about a quarter have really shown anything, and the only one that you'd say, wow, that was really a home run is Decadron. So Decadron clearly is a home run. All of these others are, like remdesivir, probably decreases your length of stay in the ICU. That's a good thing, but probably doesn't treat mortality very much. Hydroxychloroquine didn't work. Luvox looks like it works. The M monoclonal antibodies look like they work. But again, nobody's shown that they really decrease mortality. So this is another one. And, about some of these promising therapies really do work. Other of these promising therapies kind of fizzle out. Now, one of the things that I hope we learn from this pandemic is that this is going to happen again, right? So a pandemic or something like this is going to happen again. And what we really need are rapid, well-conducted studies that could give the answer. You need thousands of people to get the perfect answer, but you can get a pretty good answer after 100, right? So that after 100 people you treat, and then 100 placebo-controlled people, and really do it as a double-blind, anything that's really worthwhile, you'll definitely be able to tell. So think about any therapy we've used that is really effective. You can tell this. You don't even need 100 people, but if you had 100 people in each group, you could do it. So we still don't know about Pepcid. So Pepcid is this antacid, which has been suggested. We still don't know. We still don't know really about remdesivir. I think we do know that it probably doesn't do it. We don't know about Luvox. We don't know about all these other things. And the answer is there's no way for us to know until people actually do the studies. And that's what I hope we look at. So let's talk about the new strains. So the new strains are really important. So what happens with any living organism is living organisms mutate. As I said to somebody before, that's how evolution works, is through mutations. And most mutations are nonsense mutations that don't make really any difference. Some mutations are harmful and you die. So if you think of a human being who's got a disease with a mutation, you may die off and that doesn't get there. But if there's a mutation that is beneficial, then that mutation gets passed on further and further. And so, if there was a mutation in humans that made you resistant to cancer, say, that gene would get passed on more than the ones that allowed cancer to kill you. And after a while, everybody would have that gene. And so similarly works with microorganisms. So when they mutate, most of these are going to be nonsense mutations that don't make a difference. Many are going to be mutations which are harmful and they go away, but the occasional one is going to make it more deadly. And so there are a bunch of different strains, and they're at the different amino acid points in the protein. And they do seem to be making the disease the virus more contagious. They do seem to be making the virus perhaps more deadly, and it may be changing the proteins enough that the antibodies that we make from the vaccine or from the disease work less well. And I think there's pretty much consensus now that more contagious, I think it's still up in the air if it's more deadly, but there are some pretty good studies that show that the antibodies we make either from having the disease before or from getting the vaccine still work, but they don't work quite as well. So one of the questions we had is, well, how do flu and COVID compare? So we've had a lot of those questions over the years. And when we have those questions, it's been confusing because the way we have calculated flu deaths in the past is not from actual people who have flu on their death certificate and die. It's from an increase in the number of respiratory illnesses at that time. And we think that increase in respiratory illnesses in that time is from flu, and that's where they come up with the flu deaths. With COVID, we also measure deaths from COVID. So it's kind of an apples to oranges comparison. So the CDC finally put together the apples to apples and the oranges to oranges thing. So hopefully you can see this. So this is from the CDC going through this week. And the areas in yellow here are the actual numbers of death with influenza on the death certificate. You see those numbers are pretty small. In 2020, when COVID started, the blue are deaths associated with COVID. So I think when you look at the size of the blue bar over the sizes of the yellow little mounds here, it's enormous. And indeed, that's what it is. Now let's say you say, okay, well, let's do it the way we normally look at flu. And so the way they normally look at sort of what they call the flu deaths is they see this little black two lines here. And this is the expected number of respiratory illnesses at any one time. You can see in this time here, when there's a little peak in flu, there's a little peak in those expected deaths. In this one, where there's a bigger peak in flu cases, there's a bigger peak here. And in the past, the way they've calculated flu deaths is not to use this number, but is to use this number. So to have it even, what they did is they continued it for the COVID time. And you can see this was the difference between the black lines and the red line was the number of deaths they calculated in 2017, 2018, and 2019. But look in 2020, look at the difference between those red lines and the black curve. And so COVID is much, much, much worse and has caused far, far, far more deaths than does influenza. Actually, interestingly, this year, because more people are staying home when they're sick, more people are wearing masks, more people are getting flu shots. Actually, the number of flu cases this year is incredibly low. Just a handful of cases in the entire state. Okay, so 2 of my co-workers came back from Mexico. Their plane landed and they went to work the next day. Were they not required to quarantine before they come? Well, they really should have. So anybody who travels outside of the state of Oregon is supposed to quarantine when they get back. However, this is what happens, right? You go to Mexico, you come back feeling fine, but you're brewing the disease. You go to work for a few days, and now you spread the disease. Similarly, we had a guy who came back from South America who exposed who knows how many people as he traveled. So, yes, they really should have. However, there is no quarantine police in the U.S. There's nobody meeting you at the airplane and sending you to a hotel like there is in other countries. So in Taiwan, if you fly in, and it's not like, oh, yeah, we want you to quarantine, somebody from the health department meets you at the airport, gets you right out of the airport into a special vehicle, and they drive you to your house or where you're going to quarantine, and you have to stay there for the whole quarantine time with a big fine and lots of consequences if you violate that quarantine. Not so much in the U.S. I mean, in the U.S., we kind of just let you, we kind of ask you, we say pretty please. And I think that's why Taiwan has had very few cases and the U.S. has had a lot. So if a person wants to wait for a different kind of vaccine for COVID, will the other varieties be available here locally? Sharon asks. Well, so the 2 that are out here are Pfizer and Moderna. They're very similar in their construction. They're very similar in their efficacy. I don't think there's much to call for one over another. Now, there are 2 new vaccines that are coming out. So there are 2 new vaccines that are coming out. There's the J&J vaccine, which is a human adenovirus vaccine, and then the Novavax, which is a protein vaccine that's coming out. And those are great. I think they're going to be fine. They're going to be different. We think they might have slightly different reactions and slightly different levels of antibody protection, but we think they're going to be great. And so if you want to wait until one of those new vaccines comes out, go for it. For me, I would just take whatever is available. So somebody says, I'm 84 years old and my primary care physician is not a COVID vaccinator. What's the best way for me to obtain a vaccination when I become eligible? Well, this is a teaser for next Friday night's program, because we're going to spend most of next Friday night's program talking about our program for seniors. I believe we have one of the best plans in the state to do it. I think it is going to be great. So the answer is wait till February 8th. So the best way for me to obtain a vaccination, we're going to tell you on next Friday. So what is the recommended time frame to receive the second dose of Moderna? Is it effective to go over 28 days? There's no suggestion that you lose any effectiveness going up to 6 weeks. I mean, it was studied up to 6 weeks. But for those of us who give vaccines all the time, there's a minimum dosing criteria, and there's rationale for that, but there's no maximum dosing criteria. So we think if you get it 4, 5, 6 weeks after, perfectly fine. So Richard says, my wife and I are in our 70s and our doc is in Lane County. What procedure do we follow? Teaser. Visit us next Friday. So if somebody has an allergy to sulfur drugs, which vaccine is best? So the Pfizer vaccine, when they looked at the initial anaphylactic reactions, sulfur allergies were a bit overrepresented in the group. So if you look at the things that people get anaphylaxis to, it's usually peanuts, latex, shellfish. There were a couple of those, but sulfur, which is not one to commonly have reactions, was a little overrepresented. So people were a little worried about it. Still a very low chance, 1 in 100,000, but still something. So the answer is, if you have an allergic to sulfur drugs, I'd get your vaccine, and I'd get your vaccine at a place that is ready to treat anaphylaxis. So for example, the clinic that we did last weekend, there were like 20 doctors there and 4 crash carts. So if there was any place you ever wanted to have an anaphylactic reaction, it was that. It turned out we had none. It turned out the crash carts didn't even get opened because we didn't have any of that. So Denise says, what is your plan for folks at the clinics to get their second shot? So the second shot, we're still recommending it. Other places in the world have sort of moved on that. But what happens is anybody who gets delivered a first dose, 25 days later, they get delivered a second dose. So remember, we got our first Moderna vaccines about 4 weeks ago. Next week, we're going to receive our first Moderna second shots, and we're going to distribute the second Moderna doses exactly in the way we delivered the first. So if Clinic X got 3 vials of first dose 4 weeks ago, 4 weeks later, they're going to get 3 vials for the second. So right now, second shot looks great. So Don says, is there an antibody test for COVID? Yes, there are several excellent antibody tests for COVID, and those antibody tests can both tell you whether you've had the disease and have antibodies, or they can tell you if you get antibodies from the vaccine. Now, most of the antibody tests you get are just positive or negative, and so it doesn't really tell you how well protected you are. But yes, you can get them. In fact, every time you give blood, you get it. Is it possible to receive your vaccine in your glutes versus your arm, Amy asks. I'd have to look that one up. I don't know there would be a reason not to. I'm not sure why anybody would choose that, but you should ask your doctor about that. So are we one of the 9 counties in Oregon that won't receive any vaccine next week? No, Sue asks. No, actually we're going to get a lot of vaccine next week because remember, we got a lower amount than the state average before, and so we're going to get a higher average for the next few weeks to make up. So for example, Lane County, Deschutes County got 17,000 doses in 1 week. What? You know, they're not even twice as big as we are, and they got 17 times as much vaccine. So there's been this early maldistribution. It's early. We're halfway through we're now 1 lap through the Daytona 500. Really doesn't make a big difference. So can the virus mutate here like it has elsewhere? So viruses can mutate anywhere and any time. Viruses, though, tend to mutate, and all organisms tend to mutate when there's a lot of pressure on the organisms. So places where there's a lot of crowding and a lot of disease is where you see most of the mutations. So I've been very critical of the mink farms. You know, minks are these little ferret-like animals that live in these crowded conditions, hundreds of thousands of animals together, and they have a lot of spread among the mink. That's a real area for disaster. Brazil has been a disaster. UK and South Africa, so not shocking that that's where the variants come from. As I said before, you haven't heard about the New Zealand variant. They have almost no disease. Or the Australian variant, they have almost no disease. So the way for us to decrease mutations is to decrease spread. If we had no spread like Australia and New Zealand, we would have some mutations, but they would just be statistically so much less likely to happen when you have 100,000 reproductions in a week, like you would in the mink farms. So when and how are you going to reach out to veterinarians to assist with vaccines? So right now we have far more vaccinators than we have vaccine. So right now, just the regular clinics that give vaccines are doing fine. We have some volunteers who are working with Aviva, but for the most part, that is not the limiting factor. At this point, the limiting factor is the amount of vaccine. However, I am really, 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 really hoping for the day when, when we get more Moderna vaccine and more Pfizer vaccine. The government ordered another 200 million doses. When the J&J vaccine is approved, when the Novavax vaccine is approved, and that we say, oh, geez, instead of getting 1,000 or 2,000 doses a week, well, you can have 50,000 doses if you could do it. At that point, we are going to want to have other people, and we have a long-term plan for that, but we don't see anywhere in the next 8 weeks at least that we need that. But we will look for others to help us. So Mary says, why are church outbreaks not reported the same as other organizations? Yeah, so churches are complicated, right? So we as a people have a right to religious assembly, and so religious organizations, political things get treated a little differently than businesses and other kind of things, since they are specifically they have specific constitutional protections. So that was the decision. But church outbreaks are important. We've had 4 big church outbreaks now that have really spread a lot of disease. So even though you're you're in church and praying, you're not immune to disease if you violate the distancing, time, masking, and singing precautions. So how many vaccines do you anticipate here for the next week? We've been told 1,900, but I only believe it when I see them. So how do you stay healthy during this time? Well, there's both physical health and mental health. I think for mental health, we've really seen a lot of mental health issues. So we recommend all of those things that you can do to keep your mental health. Joyful activities each day, not to fester on the negative because there's a lot of negative out there. Meeting up with friends and talking with friends, even if you may not do it in person. Being careful about substance use. Getting enough sleep and trying to get a little bit of exercise. All I know really hard to do, but all of those things that we would generally recommend would be great. I also say that this is a time that if there's something that's bugging you, and you don't absolutely have to do it, maybe an assignment that you don't really like or something you don't really like, you can get rid of it. You have permission during this time to go ahead and get rid of something that really just annoys you. And so that's what we do for mental health. For physical health is many of the same things. We would want people to exercise. We would want people to sleep well, be very moderate in your intake of alcohol. We think getting outside and being in the dirt is a good thing. I know people say, why in the world would that work? We know that farmers and gardeners, people who are out in the soil all the time, really do seem to have the healthiest microbiomes. And so we really encourage people to be outside. You really don't have to worry about getting dirty, digging in the garden. So we recommend those things. The other thing that we recommend is a little bit of light exercise. People don't have to be marathon runners, but walking, hiking, those kind of things are great. So for those who got their vaccine last week, how will they schedule their second dose? So if you were in the big event next weekend, Aviva's going to do another event in 4 weeks or so to go ahead and get you the second, and you'll get invited for that event. Now, it turns out that in most places, about 90% of people get the first dose, come back for the second. There's about 10% say, I don't need to do that, or they move, or something else happens, and they don't come back for their second dose. Okay, well, we have a couple of other things that were kind of interesting this week. One of this was the new vaccinators in town. So Douglas County has had, I was just on the radio with Pat Ludke from Lane County. They really haven't signed any clinics up yet. And they've signed up a few EMS, but not that many. Boy, we are lucky here. Douglas County Fire District 2, Umpqua Valley Ambulance, Glendale Ambulance, Scoutdale Ambulance have all signed up, and they're going to be vaccinators. We've had dentists sign up. We've had a few already approved and a bunch in the pipeline. We have a surgery center who wants to get signed up. Plus, we've got basically all of the practices signed up. So that if you're at Aviva, if you're at South River, if you're at Evergreen, or even at one of the smaller clinics, many of those people are signed up. So for people 80 and above, rather than saying, we want you to wait in a really long line, our plan is going to be announced next Friday, but I'll give you a sneak preview that it would be, you can get your vaccine where you get your health care. So if you're 84 and you would normally get your flu shot at your doctor's office, we would want you to get your COVID shot at your doctor's office. If you would normally get your flu shot at a pharmacy, we would ask that you get your COVID vaccine at a pharmacy, at the pharmacy you go to. So we're not looking to make anything big, super duper special here. We're looking to say to people, go to your regular provider. Now, there's a lot of details, and that's why I need till next Friday to announce it. But that seems to be what the big is going to be. I think the big idea is going to be, I think we're really worried about older people waiting on the line. So my mom is 91 today, and I will call you Mom. She's 91 today. And the idea that they would say, show up at 4 a.m. at the fairgrounds in your car and wait the 12 hours until you get through just seems to be so very wrong. She's very healthy, but if you were less healthy and, couldn't be in the car that long, didn't drive yourself, needed to go to the bathroom every 2 hours or something, that is just unseemly. To be able to call your doctor and say, hey, I'm supposed to have a cholesterol check next Thursday. Can I get my COVID vaccine at the same time? They say, sure, we'll see you Thursday at 3. That would be exactly the way we should deliver this. Because this is not going to be a, 2 weeks and you're done. This is going to go on through at least September, right? So that if we do 1,000 or a few thousand a week, and we have to give 160,000 vaccines, it's going to take a long time to get there. And so, we wanted something that will go on. You know, these big events like they had at the Salem Fairgrounds, they're not going to be able to do that every day for 6 months. We want to have a rigorous prospect that keeps going. So somebody says, why are other counties getting vaccine in senior living facilities? Well, in senior facilities, there is this thing called the Federal Pharmacy Partnership, which was an agreement between the feds, Walgreens, and CVS to go ahead and do long-term congregate living. It's been a mess. It has been so much of a mess. They won't give us any information. We don't know who's covered and who's not. It is a total mess. I spent much of my morning this morning trying to figure it out. So I read that 50% of school employees choose not to take the vaccine. What would you say to them? Again, it's people's choice whether they want to get the vaccine or not. Right now we have more people who want the vaccine than we have vaccines, so not a big deal. But at some point, if only 50% of the entire population wants the vaccine, we're never going to get to herd immunity, and we're going to be dealing with restrictions, masking, school restrictions and whatever for a really long time. And so the point is, I'm telling people, get the vaccine so that we can return to some semblance of normal. Because once we get to a high enough vaccination level, assuming that the variants don't get us, but once we get to a high enough vaccination level, this will become important, but much less. Instead of having, in Oregon, 500 cases a day, you'll have 3 cases a day. There'll be no cases in Douglas County for a week, in which case you can go back pretty much to how we did things before, but we won't get there until at least 60 to 70% of the people are immune, and if only 50% of the people take the vaccine, we'll never get there. So Karen says, do we have any Canyonville vaccinators? I think we believe we have 2. Can I schedule my second dose in Douglas County if I got my first in Josephine County? The answer is no, because remember, the second dose comes attached to the first dose. So Josephine County they gave you your first dose, and they will get your second dose, depending on which vaccine you got, 3 or 4 weeks later. We do not get that dose. Now, if all of the counties early on got the same amount of vaccine, you'd say, well, it'll just sort of play off. But Josephine County, for whatever reason, got a tremendous amount of vaccine early on, like Deschutes County got last week. And so they're going to get a tremendous amount of the second dose 4 weeks after the first. So no, you have to get the second dose where you got the first dose. And I know it's inconvenient, and people have been unhappy to hear that, but that's the way it worked. And they should have explained that to you when you got your first dose here, that you need to come back here in 4 weeks to get your second dose. Other things that we're seeing. One of the things we're seeing is in UK and in Israel, they're delaying the second dose. And we're gathering data from those 2 areas to see if delaying the second dose is a good strategy or a poor strategy. And we're carefully following that. So far, not enough data to know. But I will tell you, the UK is really struggling. They have not only a high case rate, but they're now having a high hospitalization rate and a high death rate. And so pretty grim in the UK. Pretty grim in Spain and pretty grim in Portugal. And again, why it hits one of the areas or not, we don't know. But it may be that in those areas there's more variant circulating, and when there's more variant circulating, the disease is just more active. So Sandy says, is there sulfur in the vaccine? So this is one of the things. There's a thing called sulfur, which is an element, smells bad. Hydrogen sulfide is the gas in rotten eggs. And then there's a thing called sulfa with an A. And sulfa with an A is part of a group of drugs called sulfonamides. And they're not really related very much. Sulfa, the sulfonamides, are the ones that are associated with reactions to the Pfizer vaccine. There is no antibiotics, there's no sulfa, and there's no sulfur in the vaccine. So we are not exactly sure how that's going to work. or why they should have a reaction to it. It may be that people have reactions to other things like shellfish or previous things. They just have a really reactive system. So there are some people who have not a very reactive system at all. Their skin, you can scratch it and put wool on it and get it wet and dry and nothing happens. And then we all know people who have got really this sensitive skin. They go out in the cold and they get really rashy. They tend to be people with light skin and red hair where they get that. Similarly, the immune system is like that. There are some immune systems which are really reactive, and it may be that if you react in the past to sulfur or to peanuts or something else, you're also going to react to something different, but it's just because your reactivity. So, has anyone done scheduling for people with conditions like COPD and are 67 years old? Again, the underlying conditions like COPD, heart disease, high blood pressure, obesity and stuff are really, really hard to parse out. So it's really hard to know that of a 67-year-old with COPD, are they at higher or lower risk than a 73-year-old with no conditions? And while there is sort of a program to figure it out, far and away, absolutely far and away, the strongest predictor of mortality is age and not underlying conditions. And that's why in Oregon, we are using a strict age criteria. So that if you're 67 and have COPD, you will get vaccine when other people in the 65 to 70 age group get it. And that's likely to be somewhere at the end of February. So Amy says, what vaccine will we be using tomorrow? We'll be using the Moderna vaccine tomorrow. The Pfizer vaccine was a very special one-time thing that I don't think we're going to get to use again, but we're going to be using the Moderna vaccine. It seems to be a great vaccine. We've not really had any issues with it. We have some mild reactions. People sometimes with a little bit of funny feeling after it. A person called me yesterday and said they got their vaccine and had vomiting. Hard to know what happens with that. One of the questions came up is, how is Oregon doing with vaccinating overall? Actually, Oregon started off slow, like that first half lap of the Daytona 500. But now we're actually one of the top states in the country. So Alaska is the front, but Alaska is very special because they've gotten a huge number of vaccines. When you get them out there, the Dakotas, West Virginia, Oregon are at the top of the thing. So Oregon started off slow. We're moving up there, and I think we've got a reasonably good plan. Now, one of the biggest concerns, it was all over the newspaper today, was the decision to vaccinate teachers before you vaccinated seniors. And I can tell you that is one of the most controversial things that I have spent hours discussing. I can make the argument for both. So the argument for doing seniors first is that seniors have far and away the highest risk of disease and death. Although, interestingly, not only. So we looked today at the ages of people who've died in Douglas County. And let's see if I can find it here. And the people who were hospitalized. And it was interesting because, although age is a factor, and you'll see in these numbers that age is a big factor. So Laura, who's our most wonderful epidemiologist, well, they're all wonderful, but we've had 48 deaths. There have been 29 males and 11 females. 13 were in their 60s. And since I'm going to be 65 soon, that seems awfully young. 11 were in their 70s. And then 24 were 80 and above. So this really does seem to be a disease of older people, although really it seems to be 60 was the cutoff. Our youngest was 60, our oldest was 96. We had 29 deaths in November. But when you look at hospitalizations, and again, to be hospitalized with COVID is really bad. They don't just hospitalize you if you have COVID. You have to be pretty sick for them to hospitalize you. We've had 2 in their 30s. We've had 10 in their 40s. We've had 9 in their 50s, 47 in their 60s, 57 in their 70s, and 53 in their 80s. We've had 178 hospitalizations. A lot of hospitalizations. But again, it's mostly an older people thing. So you can easily make the argument we should have done older people. On the other hand, the argument for educators is that school is so important and we want to get kids back in school. And, getting kids back in school is important for so many reasons. Kids learn in school. Kids may get meals at school. They may get health care at school. They socialize at school. And when they're home, it can be an incredible burden on the parents because somebody needs to be watching the kids. And so there really, really, really are issues with school being closed. Online learning has worked well for some kids, really well for some kids, but for many kids has not worked well. So they're losing out on education as well as all the other benefits. And to get them back in school, we need to make schools safe for the teachers, because we are asking, if I was a teacher, a 64-year-old to be in a class with a bunch of people who are not immunized for many hours each day. We don't really ask that for anybody else. And so that was the argument that we should do teachers. I don't know how this is going to play out in the end. We'll have to see. Delaying vaccinations for those 80 and above for two weeks may have some toll. But on the other hand, not opening school until next fall could also have its thing. And so it's that balance, which is really, really hard. What I will tell you is, having worked a lot with lots of people who agree with the governor, people don't agree with the governor, people are ODE and whatever, these people are all well-meaning and working with the best information they have. They really struggle with what the right thing to do is. And I think one of the things we need to have is a little grace for people who are put in charge of making tough decisions with less than perfect information. And, there are people who send me emails every day. I get hundreds of emails every day arguing one way or another. And my sense is, don't argue with me. You should try and work with each other and come up with a plan that we can all live with. Because there is no one right answer, but there may be a consensus plan we can live with. Unfortunately, we got what we got. We also looked at where the disease was located, kind of all throughout the county. There's really not one space in the county which either has more disease than you'd expect or less than disease than you'd expect. Again, Roseburg has about half the people, has about half the hospitalizations. Places like Gardner don't have very many people. They don't have very many hospitalizations. So it pretty much goes. And when I did every couple of weeks, I do a disease by zip code and try and figure out if there are hotspots or not. There are frequently little hotspots that come up, right? So after October, there was a little hotspot there in Reedsport. But that kind of died out, and there are little hotspots in different places. But right now, there are not any big hotspots. And when you look over the history of the disease, there really are no hotspots. So thank you, Laura, for that. All right, let me see if there are more questions here. So Karina says, when can nursing students get their vaccine? So as a student, these are complicated discussions. So people send me all the time, well, I get this because I should get a vaccine. There's multiple layers of decision here. And one of my big pet peeves today is the people who are trying to guide people on this are very simplistic in their view. So if you are a nursing student and you're in clinicals and you're doing your didactic sessions where you're learning anatomy and chemistry and whatever else, you would get your vaccine when other college students get their vaccine, which is likely going to be in group 2, which is going to be in the April, May, or June, depending on how much vaccine we have. If you are a nursing student and you are working in a clinical place, so you're a nursing student working in the hospital, you are a healthcare provider and you should get it now and you should get it at the hospital. So it's very fact dependent. So, people wonder about, well, I'm frail, would do this. The definition of medically frail is a very clear definition. And although, we would think a lot of people are frail, the definition in Oregon of medically frail is that you need daily skilled nursing care. That's an LPN or an RN needs to come to your house every day to provide daily skilled service. And that's what the limit is. So, you might have COPD, you might have high blood pressure, you might have cancer. And I would say by a lay term, that would certainly seem to be frail or sick. But by the definition that Oregon uses, which is that you need daily skilled nursing care, you might not qualify. And that's why we've struggled with this, because sometimes the lay definition and the technical definition are slightly different. Okay, well, that looks like it for the day. It's about 4:47, a perfect time to call it quits. Again, for next week, We are going to do a Facebook Live on Tuesday, and then on Friday we're going to talk at great length about our plan for seniors. Our plan for people in 1A who've not yet been vaccinated would be to sign up at vaccines at douglaspublichealthnetwork.org. For educators, we're going to do this big event tomorrow, and we'll explain to your employers about how you can get vaccine if you miss out on tomorrow's event. And there are some people who'll miss out because they just can't make it tomorrow, or they didn't sign up in time, or whatever. But we're going to send out a note to all of the 150 educator groups that are eligible for vaccine. We'll send that note out tomorrow that will let them know how to get vaccines. And for people 80 and above, I'd ask you to please be patient for 1 week. And I promise you on Friday, we have a whole time to discuss how we're going to get that vaccine out for you. And I think the plan is great. And I think people who in Douglas County who are 80 and above can rest assured that we have a great plan for getting you vaccine. If the vaccine arrives. I can't make that happen, but I think it will. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer. Be safe and be kind. Thank you.